Hello everyone, welcome to Pediatrics by Dr. Anand. A beautiful day today. We have some another amazing student, amazing someone who had worked so hard. I am presenting in front of you. We have Dr. Rohit Gundu. He is INICT rank 38. Rank 38 as in literally 38, which is like one of the most dream rank anyone can ever get. Few numbers 38. Like there are thousands and lakhs of students participating and he is rank 38. So, I'll coming back to you only. I would like Dr. Rohit, could you please introduce yourself and tell yourself about you to our audience?
I'm Dr. Rohit Gundu. I did my MBBS from AIMS Bhopal. I'm a 2017 batch MBBS student. I'm basically from Vijayawada, Andhra Pradesh. And my father is Mr. Gundu Srinivas. He's a Chief Accounts Officer in BSNL. My mother is Mrs. Gundu Srivani and she's a housewife. I have a brother, younger brother. He is doing his Bachelor of Engineering in BITS Pilani. And I have a grandmother. And we are all five live together.
Wow, that's wonderful. The first question I want to ask you, why you wanted to be a doctor, as in the whole story of MBBS, how it started. Like you wanted to be, or someone, you got inspired by someone. How was it?
Sir, basically it was started by my cousin. He did his MBBS from Andhra Medical College, Vizag, and then it came to my mind that I also should become a doctor and treat people, and I felt it is a divine duty of any person that can be done.
Right, very true. Very beautifully said, actually. And this rank INICT 38, I mean, like, this is like I had to check three times that you are ranked 38 because that much beautiful this rank is. So, like, how was the journey?
Even me, sir, even me, I have checked it. I have checked it 4 to 5 times, and then after coming home also, I checked it. Like I downloaded my scorecard
Yeah, I
to
know
confirm
because
it. That
this is such a number that no one can believe. You have to double check. It's 3800 rank, 380. No, it's 38. So it's beautiful. So see, this is the glory. But tell me, what is the background of this whole story? Like this rank 38. If I am a new student, I also want to get rank 38. So how was the journey started? Could you just elaborate on that?
sir, for particularly for competitive exams, I started preparing from third year. Like I
Okay.
took Marrow, and I started doing the clinical subject. First I started third year subjects Opta and ENT,
Mhm.
and then I completely ignored community medicine, and then the proper clinical branches, the medicine, surgery, peds, and all.
Mhm.
And then I started preparing for the first and second year subject. Uh, in Then I took Unacademy, sir,
Okay.
and I did first year and second year mostly from Unacademy only,
Mhm.
and pediatrics especially I did from Unacademy classes of yours,
Mhm. Oh,
and that's it, sir. And like
great.
I went with the flow actually. I mean, I wanted to become a neurologist,
Okay.
and I prepared accordingly. I mean, I wanted to take a seat in enhanced neurology.
Okay, okay, that's wonderful. So I'll repeat again to our wonderful audience. We have among with us Dr. Rohit Gundu. He has done his MBBS from AIMS Bhopal and he stays in Vijayawada, Andhra Pradesh, and he is INICT rank 38. So coming to this rank, Dr. Rohit, could you please tell like how many hours a student should study? Like 4 to 6 hours, whole day. Like how the study hour pattern should be divided? Could you tell that?
Uh, Sir, during my internship, sir, when that would be somewhat hectic, and I could only manage to study for 5 to 6 hours a day. Not at all more than 5 hours. Also, mostly 5 hours a day.
Right.
And few days I would be feeling so bored that I would stop studying completely. And some postings are so hectic that I couldn't even study.
Yeah.
Then it was very difficult for me, and I could get only 514 rank in last inset.
Okay.
And now I am preparing at my home, and I I studied for approximately 12 hours a day with intermittent breaks, and then
Okay. That's wonderful.
managed to.
And this, one student, he was telling me that, sir, I prefer studying in library instead of studying at my house. And I have seen a lot of students literally shifting from house to taking a small flat or taking a library and working or studying over there. So, what is your take on that? Can we study at home also, or is it important to shift to some place?
Sir, studying at home, and getting a rank, I can set an example for that, sir.
Mhm.
And
Very
there is nothing wrong to stay away from home and preparing at some library or some study points. But
good.
what I felt was the family support is must, and whether it is emotionally or economically or anything,
Right.
they will support us well to crack my
Mhm.
exam.
Right. But your mom doesn't tell you, go get milk, go do this work, go do this
Yeah,
work.
those all will be there, sir. But they were very less when I am studying, and when I take a break, then they would ask me to get something or they get something done.
Okay, okay, nice. And one more question we have this, our audience were asking this, like how to maintain the hope of doing the study for a long time, like 5 days, 10 days, maximum 15 days, sir, I can study. But, by the end of the month or maybe by 15th day, continuously studying morning to evening, it becomes very difficult or sometimes you're not positive every day. So how to cut that monotony and how to keep charging yourself? What was your charging force that I have to do it? Because studying continuously for 12 hours or these hours is very difficult. So how did you manage that?
Yes, sir. Sir, this I want to discuss in two parts, like when I'm in internship and MBBS, and then after when I came back home after my internship.
Mm-hmm.
So during my internship and MBBS, then we had to go to hospital, we had to spend there, we had to spend with patients, and it would be very difficult to come back and study.
Yeah.
Then I used to take breaks frequently, like with 3 days break in a 3 days or 1 week. And in a stretch for 15 days also I couldn't study, sir.
Mm-hmm.
When a new movie releases, I would go. I mean, I would take my friends or my juniors to be along with me,
Very good.
and even I went singly if I am bored to such an extent. And then after coming home, sir, staying with parents and taking their support, I could manage to study at least for 10 days without a break, and
Okay.
then 1 or 2 days of break between 10 days.
So 1 or 2 days you literally used to like go out
Yeah,
somewhere
no,
or
no, no, nothing.
okay. Like after 10 days of
Just,
continuous studying, then 11th day you
yeah.
used to go out or watch a movie. How was it?
Sir, watching movies or YouTube, some funny videos or something in YouTube, and the series.
Right.
Uh,
Uh-huh.
I
Great.
watched two series in this whole 5 months.
Which
One
one?
is Brooklyn Nine-Nine,
Mhm.
and one is Modern Family.
Okay. Modern Family. Yeah, it's going good. How is it? It's
Yeah,
nice.
it's nice, sir.
Great. And one thing also I want to ask you because as we all know nowadays, little competition is on the high side. So about this
Yes.
dummy internship, many of our students come to us and ask us that, sir, internship I should sit and study. I should not go to my ward or this and that. So what is dummy internship in your life? Is it important? What do you prefer to our students?
Sir, I didn't get a time to study properly during my internship, but the things that I did in internship are worth it, sir. Because in medicine we used to collect samples, and uh, and we had to send different colors of vials for different samples. And
Right.
these questions are basics in Inicet exams. Like now
Mm,
also they ask the order of collecting samples, different colors of samples,
mhm.
and which sample, like the frequent questions are what are the components of each vial and what tests will be done in each vial.
Yeah.
And so these all became a part of my life actually. And I like we had in first year in biochemistry, second year microbiology and
Mm,
pathology, they would ask a certain color of vial, and they'll ask composition, which all tests will be done in those. But
yeah.
when we are in a line for to go for viva, then we used to rectify them and just
Mhm.
reproduce it as it is. But
Uh-huh.
after coming into internship and after learning them like practically, then we
Mhm.
then it is not a, like, what to say, it is a part of my life, sir. That's it. It
Mm.
became a part of my life.
Very beautifully said. I think this is a very important message which Dr. Rohit Gundu has shared with us that, basics are everything and don't miss your postings. Don't miss your internship. For all those students, we have so many queries coming on email and WhatsApp. I want to prepare for my PG exam. I'm planning to do a dummy internship from a periphery and just study for 1 year. See, studying is fine. It's very good. But at the same time, who will teach you the clinical approach? Because nowadays all clinical questions are coming, hands-on questions. If you are the doctor on duty, what will will you do? So by being an internship, our interns in our Hindura hospital, they conduct deliveries, they help in cesareans, all the sampling, labor room is fully full with patients and sampling. So I think it's a huge, positive learning experience which you cannot get anywhere. So I'll repeat again, we have among us
And
Dr. Yes, please, Dr. Rohit. Yes, please add.
And one more thing is, sir, these dustbins and all stuff are also very important.
Yeah,
And I learned them we used to remove folies or insert folies, or like this like collecting blood samples, throwing away vials, expired drugs, and these things. So and nursing staff themselves taught us all these things, and I
yeah.
learned everything there only.
That's very good, and that's very true also. See, everything starts from basics, and in exam they ask a lot of basic questions. My JRs also, whenever I've been putting out the gloves, and I'm like, where will you discard? Where will you discard? So all the plastics go into red. Folies, where do you discard? Red. So all these Euro bag red. So such a simple thing, and these are very common questions. CBC, which vial I should set? Red vial, pink vial, which vial? Such simple question. If you start cramming them, that's a very that's not good actually. Basic thing you should not cram, because basic you can learn in nicely in your internship postings, right?
Okay.
So yes, so very beautifully, I'll repeat again, we have among us Dr. Rohit Gundu from Vijayawada, Andhra Pradesh, and he is INI-CT rank 38. And I'm noting some important points which Dr. Rohit is saying. Number one, he said that his family support played a very important role in his life, and he is one of the best example where a student can sit at home and have a supportive family and good food, and he can get a INI-CT rank 38. Because 99.9% students I have interviewed, and they all have said, no, no, घर पे तो बहुत distraction होता है, a lot of distraction is there at home, so I should go out and study like that. One more question I want to ask you over here. Final year MBBS, like, were you studious in your final year MBBS also? Like, we like, there are a lot of students who are from private college or who are not that intellectual, I would say. So how was your final year? You were studying from back to back, or how was it?
No, sir, like not back to back, but sir, I'm not an extraordinary student also in theory exams. I just got 70%, and we didn't had third year exams, sir. We had all the third year subjects in final year only,
Mhm.
and that became advantageous for me in one aspect, because I did only most of my clinicals from Marrow only, so I read everything, like for once for pre-professional and once for professional.
Right.
So these clinical subjects, I felt there is there I had no need to repeat them again and again, to revise them, like
Right, right.
so,
I got it. Very true, very true.
so
And what should it be our last week approach? Like, this is one of the most commonly asked question by a student. Like, I am studying for last 6 months. It's nice, but last 1 month left, last 2 weeks left. Because I have met a lot of students who are really wonderful and commendable, but they could not get a rank because they got blackout in the last 1 week. And last 1 to 2 weeks is the most crucial time where you should be, your focus should be on, and you should know what to study and what not to study. So what advice you want to give? How was your approach last week for exam?
Sir, last week I did only the repeated topics, and most frequently asked topics. Like for suppose in pediatrics only, I did milestones and immunization schedule,
Yeah,
and a few points about immunization which are frequently asked,
right.
and like the Silverman scoring,
Hmm.
Apgar scoring. These things I did, sir. And like for every other subject also, the topics which are frequently really repeated I studied. Like HIV is a frequent topic that is asked in
Yeah,
pharmacology, pathology, even microbiology, medicine. These things I did, sir.
true. And did you skip any subjects? That also we had a lot of queries, that there was a student saying that major subjects are important, minor are not important, or just do 8 or 9, 3, 4, you leave it. Is it that way? How was it?
No, sir. I gave importance to all 19 subjects equally, because after doing last Inicet, sir, I came to know that the exams which are be conducted by the government, like the AIMS people, they use they give basics only, like they
Yeah,
stress more on basics. Like in this exam also, I didn't find core medicine subjects topics. Number of questions that were asked in core medicine or core pediatrics, even five, like pediatrics also, the questions posted by you, sir, they were nothing. I mean,
Yeah.
core pediatrics in them.
Yeah.
Uh, this incubation time, that is
Yeah.
common for
Patient period.
PSM medicine
Yeah.
also,
Mm-hmm.
and vaccines, that is also common. Right? Even I don't think it's a pediatric question. It's a pharmac, a advanced event in
Yeah.
pharmac.
Mm-hmm.
And medicine also, sir, I didn't find any question related core topic of medicine like that, sir.
Because my
Everything is
HOD
basic.
also used to say, my HOD used to say, common things are common and rare things are rare. So that's what it just.
I remember that, sir. You use that frequently in your classes.
Exactly, because common, like that's what even in USMLE, MRCPCH, you are the doctor on duty. What will you do? What will you do? It's always like that. What will you do? So, like that clinical oriented knowledge plays a very important role. And rank 38, I mean, like, what was the reaction? Like, this is another level of rank. And your parents, did they believe you? Like, you got this rank? How was it?
Yes, sir, they were very positive that I would get a rank below 50 in Inicet. And actually, it was me who was panicked if I could clear it. I mean, if I get a rank, double digit rank or not. They were very sure that I would do it. So,
That's
and they were
wonderful.
very happy now.
And what is your future plan? As and I want to ask you, what where do you see yourself after 5 years? Like this rank 38, how fruitfully you're gonna use it, and what are your future plans?
Sir, I want to do DM neurology directly in NIMHANS.
Mm-hmm.
And this session, they are providing 4 seats for the direct DM. So there are high chances that I can get a seat there.
Mm-hmm.
So I would take DM.
Wonderful. I think this is one thing which you have shared. It's one of very good message for all the upcoming viewers, our future generation crowd, that with the work so hard, so beautifully that you get a rank, that you can get anything, and then the story of life becomes much more meaningful. And okay, so the last question I have for you is like any wonderful advice, and yeah, one thing also I want to ask you, any issues which you any problem which you had during the preparation, as in do you want to advise someone which you by mistake had done and you don't want the next batch to do, any mistakes you did during preparation?
Sir, mistakes is only one thing, sir, that I panicked a lot. There was
Mm-hmm.
FOMO, but I advise that FOMO is nothing, because even I went prepared well, but I couldn't do 20 MCQs were out of my like
Mm-hmm.
knowledge at all.
Mm-hmm.
And by chance, sir, I marked all to 200. I didn't and sir, I basically, what I felt was, even if five are correct, then if we do the 15 wrong, then negative marking is 5 marks, which is neutralized. And
Yeah.
I managed to get 8 questions correctly, so which is a gain actually. Nothing to lose, sir. Just it may be neutral or there may be gain. So there is no point of missing any question. Even मतलब तुक्का भी चलेगा ऐसा.
Mm-hmm. Chalega, that's true. So very beautifully, very well explained and told very nicely by Dr. Rohit Gundu. So I'll quickly repeat again what all beautiful points he has said. Number one, he is a perfect example who says that you can sit at home and study nicely and get a all India rank 38, and he is the perfect example for that. So all those students who thinks that no, at home I can't study, if you have a proper discipline and timetable, I think definitely you can. Also very beautifully he has explained that starting from the third year, like he started his journey from third year MBBS only, getting the topics correct, getting the concepts correct, and he used various platforms to get his logics cleared. And also he has emphasized on a part that don't do dummy internship, guys. You better do a proper internship from a proper medical college, have a exposure, have a learning experience, and that will make your brain remember much more, which is otherwise just cramming and copy pasting in exams is not that beneficial. So before leaving, Dr. Rohit Gundu, any happy advice you or message you want to share to our generation?
Sir, one thing is about internship and clinical postings only, that they should not be missed by any chance.
Mhm.
Like, sir, the exams are becoming so clinical that they are asking what are commonly done in wards and all.
Mhm.
Like, how many layers of suturing will be done in episiotomy? Who knows when, if they don't go to the labor room only.
Yeah, true, very
Then
true.
and these NIS and all, the
Mm-hmm.
schedule, we were made to sit in vaccination centers, our community medicine vaccination center, and we are made to supervise that actually.
Mm-hmm.
Then only I learned NIS thoroughly actually.
Yeah.
So and one thing is that not to miss clinical postings and internship, and then sir, not to get panicked, and whatever we read, and we have to do good at what uh, मतलब
Right.
क्या बोलते हैं
Ah, I
हाँ
got it. I understood. So perfectly right. So that's what he said, that fear of missing out should not be there, because when you have so many online digital platforms, you get scared. अरे वो वहाँ अच्छा पढ़ाया था, अरे MCQs वहाँ पे अच्छे हुए हैं, MCQs इस ऐप पे अच्छा है. And that's what I want to tell to all students: follow one platform and follow that platform religiously. It is as simple as that. Otherwise you will be in a lot of trouble if you study this thing from that app and this thing from this teacher. It's going to be very difficult. So follow one educator religiously, and that will make your journey much smoother and easier. And also, Dr. Rohit has beautifully told basics plays a very important role. Multiple times he's emphasizing that whatever hands-on experiences and clinical things he saw in his clinical postings, they actually helped. And that's very true in my journey also. That's why I always have a photographic or a video memory. Whenever I see a patient of syndrome, I take a photo, take a video, and post it everywhere. And that will be like, oh my god, I remember this. You will, because visual memory is something you can't miss. That theory you might miss because there's so lot of things to read, but visual memory is important. What do you think, Dr. Rohit, on this? What do you think?
sir, absolutely true, sir, absolutely,
That's
because
Hmm.
uh,
Very true.
like
So that's it. We have, thank you so much, Dr. Rohit Gundu from Vijayawada, Andhra Pradesh. He's INI-CT rank 38. We are very happy for you. And I think every student who's watching this video will be inspired from you, because we need people like you, who are working hard, who are a family people, loving the family, caring the family, and at the same time, achieving your dreams. That's very good. So thank you so much, Dr. Rohit. Thank you, everyone. Please take care and see you around in the next video. Till then, bye bye. Thank you.